Please let me know when we are live. Hi, we're live? Okay, great. Hi, YouTube. Hi, good morning. Good morning. Welcome to the Lurie Daniel Favors Show. Today is going to be a really quick live because we have a lot going on and I have a number of guests today. So usually when that happens, I don't have time to do an extensive live with the community. But just know that everything I'm talking about right now is also going to be covered in today's podcast episode. Now, Urban View and YouTube, we have some things we got to figure out. And you know, in The Color Purple, when Celie is looking at Mr., because Mr. is she's finally gotten the courage to leave. She and Suge Avery and Buster, they getting ready to head out. Miss Sophia done come out of her comatose state, and Mr. is like, you poor, you black, and he's like cussing her real good. And then she does this thing. Right? She does this thing with her fingers, and you in Urban View who can't see me, I'm doing the Celie root curse, and that's where I've got my thumb and my forefinger, my middle finger, and I'm holding it out at the screen. And what does Celie tell Mr.? Celie tells Mr. in a calm voice that clearly indicates Celie is over it. She's done with it. She's moving on. She has decided that this beast, this horrific person, who himself was a beast and horrific because of the beastly things that had been done to him. I think we often forget that Mr. was a creation, right, as a result of the society that he lived in. But Celie holds up her fingers to him, and she says, everything you done to me, already done to you. And then she's free. It's like she's free. And she said, the jail you built for me is the one you gonna rot in. And in the Caribbean, there's this phrase, you dig a hole for me, dig two. Because whatever you have done to plot for my destruction and for my downfall is already been done to you. This is a story about white people and your healthcare system. Because white people, the reason your country is in this situation right now is because of all of the evil, horrific, diabolical things you have done to black people to exclude us from healthcare. And now it's biting you in the ass. So over the past few days, we have been talking about the fact that the 8 Democrats, the elite 8 that we're calling them, and they were calling them elite because they all get benefits from the airline industry. They're all very, very wealthy. They're all very old, and they're all very white. And these are 8 Democrats who basically decided to side with the Republicans and shut down or end the government shutdown without a promise that they would renegotiate the extension of the Affordable Care Act subsidies. Now, this really matters because as you're going to hear from this woman, please pull up the Instagram clip shared by Black Home Educators. As you're going to hear from this woman, she is a white woman, who has just now learned what her health care subsidies are going to be as a result of the ending of the Affordable Care Act subsidy program, which was a part of Obamacare. I'm going to share my screen so that you on YouTube can watch this video clip because it's important that we're all aware as to exactly how we got into this position. Because a lot of y'all think it's just because the Democrats and the Republicans couldn't agree. No, it's white people's fault. Take a listen to this clip now.
Guys, just a quick video about my health insurance nightmare. So I got my letter yesterday from Blue Cross Blue Shield of North Carolina, and my health insurance premium is going to go up from $218 a month to $1,408 a month.
Jesus.
Yeah. That's a 546% increase on my health insurance. And it's particularly galling to me because I watched Dr. Oz stand in the White House press briefing room yesterday, and when asked by the press corps about these letters everyone was receiving all across America about these astronomical increases, he said that it was not true, that no one was receiving more than a $50 increase. Now, obviously, the cat's out of the bag. People know that it's going to be more than $50, but please make your videos, make our, voices heard here so they know what's going on. Please call those folks in Washington so that, the Chuck Edwards of the world can hear how you feel about the fact that he voted for that big, ugly bill. And now, the result is a 546% increase on health insurance.
That's a shame. That's a real shame. But it's white people's fault. And here's why I say this, because it's true. It's true. According to an article in the New York Times, which I go into far more extensively in the podcast episode, and a number of other writings as well. It just so happens this was one of the rare moments where the New York Times was doing honest journalism. But the article is pretty significant because it explains in great detail how it is we got to a situation where white Americans and all Americans don't have access to health care. The article is entitled, "Why Doesn't the United States Have Universal Health Care? The answer has everything to do with race." And this was an article by Janine Interlandi written on August 14th, 2019. And basically it provides a synthesized version of the history that talks about what was happening after the end of the Civil War. After the end of the Civil War, you had 4 million newly freed Africans. Many of them ended up staying on the plantations where they had been previously enslaved, and they stayed on those plantations or plantations in the surrounding area to work as sharecroppers. Now, working as sharecroppers was another form of slavery, but it also meant that you weren't going to be subjected to being incarcerated for being a vagrant or being homeless. Now, they had implemented these laws called the Black Codes after the end of enslavement. The Black Codes used to be the slave codes, but you couldn't call them slave codes anymore because there was no more any slavery. It was just blacks. And so the Black Codes basically were laws that only black people could be convicted of. And some of those laws included things like you couldn't be jobless, you couldn't be homeless. And if you were jobless or homeless, you could be arrested and tried and convicted and jailed. And then because of the provisions of the 13th Amendment, once you were arrested, tried, and convicted, you could then be subjected back to slavery. And so being jobless and homeless basically was the overall condition of these 4 million newly freed Africans. And so many of them ended up staying in sharecropping situations, which was a new form of slavery. Others of whom were able to leave and escape ended up forming these encampments because they had no more homes and they had no more jobs and they didn't have any money to take with them because they weren't being paid when they were working as slaves. As a result of forming these encampments, they had access to very little food. There was very little shelter. They were exposed to the elements. And so what was also happening at the same time was the Union troops and the Confederate troops were also dealing with a whole lot of ravages of war. So a lot of people were sick. A lot of people did not have access to the food that they needed. And because the plantation crops had not been harvested, similar to like what happened when y'all ran off all the migrants and the migrants were no longer able to pick your crops. And so your tomatoes and your strawberries are just rotting in the goddamn fields today. Similarly, this was what was happening at the end of the enslavement era because you no longer had enslaved Africans who were there doing the free labor for you. You see how history rhymes, it repeats, and it does all the things. And so what ended up happening was the outbreak of disease. And a lot of white people told themselves, well, we are not going to allow our white medical doctors to provide any resources for the blacks because the reason that they're getting sick and dying is because they're allergic to freedom. Freedom is going to be very bad for the blacks. They only can successfully live while enslaved. Y'all, this is actually like they said these things. They talked about these things and they talked about them extensively. And it makes a lot of sense when you consider these are the same white people who said that black people who ran away from enslavement were suffering with the mental illness known as drapetomania, a mental illness that caused the enslaved to want to be free. Only a white, cultured-minded person would come up with something like that. But basically, they ended up being exposed to a whole host of sicknesses and diseases, and white doctors refused to service them. White hospitals refused to service them. As a part of the Freedmen's Bureau, you had about 120 doctors who were dispersed throughout the South, who were then able to provide some measure of medical services for black people. You also had the establishment of 40 hospitals that were owned and operated by black people that were ultimately later shut down because of the rightness and the racism. But you had a system where we had immediately upon the ending of enslavement had a segregated healthcare system. Now, one of the things the Freedmen's Bureau was trying to do was to establish a federal healthcare system. This was the first time that America had considered a federal healthcare system. So when we tell you that the only reason we even have notions of federal healthcare in this society is because of black people, it's because of this. It was coming out of the Freedmen's Bureau. But the end of the day, the Freedmen's Bureau ends up collapsing, and we had doctors, the first black female doctor in particular, Dr. Rebecca Lee Crumpler, who was born free. She was trained and she practiced medicine in Boston. She ends up working with the Freedmen's Bureau before it collapses, and she ends up publishing one of the first treatises on the burden of disease in the black communities. And she wrote that the white people basically, they seem to forget that there is a cause for every ailment and that it may be in their power to remove it. Basically, this black woman was like, y'all the problem. Y'all the problem. You got the answers. You got the answers, Sway, but you don't want to use them for black people because of your racism. Now, the article goes on to talk about in the decades following Reconstruction, this pattern of excluding black people from healthcare continued. And you know how we talked extensively about the New Deal and all these things that FDR did at the end of the stock market crash and the Great Depression to provide for the social safety net that the Republicans have spent the past decades trying to dismantle? That included access to healthcare. But because of the racism and the power of the racists who came back into power after the end of Reconstruction, you had basically white racist people who were determining who was going to get access to benefits. And that meant that black people were excluded from the Social Security Act. They were excluded from the rights to collectively bargain. They were excluded from being able to participate in unions. They were excluded from the Fair Labor Standards Act of 1938, which basically allowed for minimum wage and an 8-hour workday because white people were used to black people working 7 days a week, all day from sunup to sundown. They were excluded from the GI Bill decades later. They were excluded from the aid to dependent children. So black people have largely been excluded from all of these benefits, and healthcare was also one of them. Now, in 1945, President Truman demands that Congress expands the hospital system, the nation's hospital system, as a part of a larger healthcare plan. And basically, the white racists decided that they were going to ensure that all of these benefits got to be distributed at the state level. And they did that because they wanted states' rights. And states' rights to do what exactly? To ban black people from being able to participate. So they created this healthcare system. They nationalized a healthcare system, a healthcare plan, but refused to allow black people to participate in it. Professional organizations like the American Medical Association refused to admit black doctors. I'm talking about the AMA that still exists today. Medical schools refused to admit black students. A lot of the hospitals and the healthcare clinics would segregate black patients. And the federal healthcare policy of the time was basically, according to the article, designed both implicitly and explicitly to exclude black people. So black people had to do what black people always did. We created our organizations. We created a national community healthcare movement. We fundraised for black healthcare facilities. We had campaigns to educate black people about nutrition and sanitation and disease prevention. So when we talk about the Black Panthers providing healthcare clinics where they were screening for sickle cell, where they were screening for tuberculosis, this is all coming out of that same legacy of do for self. Now, in the mid 1900s, it feels weird saying that because that's like when my mom was alive. Like in the mid 1900s, you had a situation where basically the National Medical Association, which was the leading black medical society, was now in direct conflict with the American Medical Association because the American Medical Association did not want nationalized health care. The black community was saying, we need a federal health care plan. By the 1950s, black people were proactively pushing for universal health care. They were pushing for us to have a health care plan that could provide for health care for everybody because even though white people had excluded us from everything, we were still trying to think about systems of care that would allow for everybody. But having a public healthcare system that would provide for everybody was not going to be racist. And so the American Medical Association refused to participate in it. Now, later on in the podcast, I'm going to explain to you exactly how the American Medical Association did that. They not only worked to not allow for a universal healthcare system, they also are the reason why your healthcare insurance premiums even exist at all. Because the American Medical Association played instrumental roles in making sure that you had to have privatized healthcare insurance. The only democratic European white nation on the planet to take this effort, but that's because the American Medical Association was more concerned about profit. And so basically the AMA called healthcare for everybody socialist. They called it un-American. They said that the government is going to intervene when your doctor-patient relationship. And so instead, they created a healthcare system with health insurance so that the insurance companies can intervene with your healthcare system with your doctor. And so everything that white people have done in this society, culturally, historically, to prevent black people from advancing is biting y'all in the ass right now. Because the reason you only have healthcare premiums in the first place was because you were so willing to exclude black people, your ancestors and your elders, many of whom are still alive today. You were so willing to exclude black people. You wanted to prevent black people from getting access to anything that you set up a system that meant you don't get nothing either. How's that working out for you? Everything you done to me, already done to you. And the jail you built for us is the one you gonna rot in. So white people, I need you to really think about what is it that you really want. Do you want health care? Really? Because if you really wanted health care, you've had decades of opportunities to fight for it, but your racism got in the way, the same way it does for everything else. Y'all used to have pools. Remember when white people used to have swimming pools everywhere and you didn't have to have a private pool in your backyard? What happened? You didn't want to share water with the blacks. And so you shut down all of your swimming pools. Now, if you're not wealthy enough to have a private pool, ain't nobody swimming. This is another of many examples that white people really have to grapple with because y'all have a sickness. There is something wrong with you. In fact, the sickness is called, oh my gosh, where is it? I have a book here. I cannot find it. It is Dante King's book. Damn it. Anything by Dante King you all should be looking at. I don't have the book up here with me right now, but basically y'all have a psychopathic, sociopathic illness, an ailment that causes you to block yourself out from the goodness that this planet has to provide because you're so busy being racist as fuck that you can't tolerate the idea that black people would get it too. We're going to pause this here because I have some great guests I'm bringing on. As I mentioned, we have a lot to get into today. So I'm going to do more of this conversation in the podcast later on, and we're going to go extensively and we're going to go through this article extensively because it's really important that we, as we are doing the work of trying to build better societies, as we are doing the work of trying to build a more healthy collective, we as black people also got to know what white people are willing to do to prevent that from happening. White people are proactively willing to die from ailments and diseases and not have access to health care if it means they have to share it with us. Now, you may be thinking, well, Lurie, not all whites. Well, okay, maybe not all whites, but the righteous whites have not mounted up sufficient enough effort to prevent this from happening to be someone that we can rely upon. So as we imagine what this new world looks like, as we get ready to do the building of this new world that we have to do, we got to remember this history because everything they done to us already been done to them. But what we cannot do is allow ourselves to go down with their ship because, baby, that's the last thing we have the capacity to navigate for in this day and time. YouTube, love y'all. Got to go. We have a lot of guests coming on. Urban View, we are going to get ready to head into a commercial break. YouTube, again, check out the podcast. I'm going to talk about this way more extensively and much slower.